Hi. So today we're going to be talking about integration principles. So let's talk about what integration is. In your practice of yoga, whatever school of teaching you come to me with, at this level, I want you guys to think about integrating all body functions into the yogic practice. And that's why we coined the term, or we name our teacher training functional yoga medicine. Yoga is the umbrella that integrates all body parts together, right? So, integration is actually combining or coordinating separate elements so as to provide a harmonious, interrelated whole system. And it's your job to make sense of this for your respective clients. It's the ultimate outcome of practicing the alkaline method yoga. It refers to the complete connection in the body and mind that actually enables an efficiency of movement, optimal alignment that prevents injury, strain, or pain, and it enhances metabolism, detoxification, and of course, elimination. So, integration requires awareness, patience, time, and consistency. It takes time to master, but absolutely necessary for optimal results. So, number one, we've got six different elements that we'll be talking about. Okay. Number one is mind body integration. Mind, right? It's our brain, it's our central nervous system to our peripheral nervous system. It's the mind body integration. Mind body mastery requires one to be aware of their faulty posture or alignment. They have to be aware first and foremost. They have to house this body, mind in the body. And that's a lot of the times lacking when the client is coming to your class or your clinic. It requires them to be aware of their structural malalignments, restrictions in their fascia and soft tissue, weaknesses and imbalances within the body. This also requires them to have dristi, which is the focus. It's the place between your eyebrows, as you know, and their breath, and focus into their body and be fully present in their body to direct the mind to move the body with awareness and self correct to have a self healing effect as they go into and out of each pose. That's number one. Second integration principle is breath integration. Breath is life, right? It's where the carbon dioxide and oxygen exchange. When you breathe in oxygen and you breathe out carbon dioxide, right? So it enhances your body to have that carbon exchange in the body. Helps with, again, detoxification, elimination, and of course, metabolism. The goal is to bring awareness to the breath both anatomically and physiologically. Inhalation should expand the rib cage with spinal extension, and exhalation should contract the ribs and create a spinal flexion, slight spinal flexion. Inhalation opens, exhale down. Really, in reality, if you're doing this correctly, only the ribs flare out and only the ribs contract back in without involving the spine. But if you were to look at the more of the facilitating movements, it's the inhalation will create typically spinal extension, and then exhalation will create spinal flexion. The rib cage should expand sideways, backwards, front without muscle compensation. Muscle compensation commonly that we see is the neck, right? And the shoulders. They're all tense up here. Or they're shallow breathers. So there's no full excursion of the breath into the rib cage. Remember, we've got the left and the right lobes of the lungs on both sides, and they are occupying space under the rib cage. So as the rib extends or expands, it's getting all the oxygenation into the lungs. And then as it contracts, it's able to get all the air out of the lungs. The rib cage should expand again, forward, sideways, and back. And it's common to create tension in the neck while breathing, but this should be avoided. The exhale should maximize tension and maximize control. Okay. And third thing that we look at is pelvic and spine integration. The pelvic region is the heaviest part of the body. The pelvis and the spine should be carefully examined to make sure that the spine is perpendicular to the pelvis. A working alignment should be balanced by activating the proper muscles that stabilize this region for optimal movement. This region must be integrated with the ribs as the transversus abdominis, one of the four core muscles, span vertically from the inferior border of the anterior ribs down to the pelvis. Anterior and posterior tilt of the pelvis with the breath is a great way to feel the integration between the ribs and the spine and the core and the pelvis, of course, using the accessory muscles of respiration, which includes the core muscles. And I utilize this activation, the accessory muscles, to get my clients to engage with their core muscles. Because as you and I both know, many yogis or people, clients that come into your clinic or your patients, they don't always know what core activation feels like or looks like. So it's your job to teach them. And there are a multitude of different ways to do that. And we'll go over that in the future lessons to come. Fourth integration is feet, ankle, and knee integration, right? Feet, base of support, the ankle and knee integration. The feet and knees have to be kinetically aligned from the base of support. So in standing, it would be the feet, ankle, knee, hip, shoulders, and the head. This changes in downward dog, in plank, chaturanga, chair, etc. Understanding the kinematics of your body, alignment, posture, and anatomy and structure is key to keep the practice integrated to optimize movements and efficiency. Fifth, fifth integration pillar is shoulder, scapula, collarbone integration. So, shoulder, scapula, collarbone integration. Shoulder should be drawn down and away from the ears. And by doing so, like create a decompressive effect in the spine, meaning when the right shoulder blade tucks into the left jean pocket, left shoulder blade tucks into the right jean pocket. As you do that, you should feel the lift and the pull up, surging up toward the ceiling. Okay. And that's commonly something that I really emphasize. Common shoulder compensation is the upper trap tightness due to forward shoulders, winging of the shoulders where the scapula lifts up and away when you go down onto your hands and knees. For example, in plank, if the scapula lifts away from the ribs, that means the serratus anterior is weak, causing winging of the shoulders. This is improper alignment of the shoulders. So you want to make sure you round and really activate the serratus and get really, really strong there. It's important to remember that the shoulder blade or scapula has its own movements that are separate from the shoulder. Remember, shoulder is ball and socket, so it's got 300-degree movement, right? Scapula rotates up and downward, and then it can abduct and adduct to allow the motions of the shoulder. So when I'm abducting or abducting my shoulders, the scapula is rotating out. And when we talk about the movement of the scapula, we always talk about it in reference to the um, inferior border of the scapula down below. So as it tilts upward and tilts in, that's abduction and adduction. And then it might go forward and back as well, right? So protraction and retraction of the scapula, upward rotation and downward rotation. These are all motions that's available in the scapula, right? Scapula can rotate up and down, forward and back, depending on the motion of the shoulders. And shoulders, again, as I said, has 360 movement, and it should be in sync with the movement at the scapula. The final sixth integration principle is the head, neck, and jaw. It's common to have a forward head. Remember, the head weighs between 20 to 25 pounds. So if it's displaced forward, common thing that we see is a lack of lordotic curvature in the cervical spine, which can have a lot of tightness. A lot of people come with tightness on the front and they have limited range of motion in their cervical spine. And that's something that we want to make sure that we fix so that they can have full range of motion in their spine, especially in their neck. So, cervical spine, it's common to have limitations of its movement due to faulty alignment and posture. So it's imperative to align the head over the shoulders and strengthen and stretch the necessary muscles and joints to enable full range of motion of the cervical spine. Something to keep in mind, if the patient had head trauma or some type of motor vehicle accident or an whiplash, they might have a lot of muscle memory and compensatory pathological patterns up at the neck, or hypertrophy, meaning it's spasmed shoulder traps or upper traps, and the muscles around the scapula might be super duper tight, causing a compressive effect. You always want to make sure that their head is not displaced forward to make sure that you create balance in their body. Because at the end of the day, when you're sitting up nice and tall, standing nice and tall, it should be effortless and you should be engaged with those muscles that hold you up against gravity. It's important to understand that also our jaw, the TMJ structures, is directly over our pelvis. And so in physical therapy setting, the jaw, if you have TMJ issues, almost always you can find that patient also has low back issues due to the pelvic innominate rotation and compensatory patterns there, causing lots of issues at the low back. So you always want to check the kinetic chain down below and always remember that the jaw should line up with the pelvis. And so if they do come to you with TMJ issues, always look down towards your pelvis. When the movements become difficult, it's common to see clenching of the jaw as well as um, So it's important to keep this in mind to prevent unnecessary strain to the neck and jaw. And it may be something that they routinely do. And it's their way of accommodating stress in their lives too. And a lot of people, they clench their jaw or they grind their teeth when they're sleeping because of the chronic stressors in their lives. And when they do that, a lot of the neck musculature and the shoulder musculature tend to be super duper tight, also adding to the improper pathological malalignment with improper muscle adaptations and muscle memory that aims to get them really, really in big trouble down the line. These are the clients that are coming to you for yogic practice. So it's super important that you understand how to look and integrate the whole principles. Remember, body and the mind, that's the number one integration, or mind body integration. Second integration is breath integration with the rib cage and understanding the movements available there. And then next is the pelvis and spine integration into the hips as well. And then feet, ankle, and knee integration. Then the shoulder, scapula, and collarbone integration. And lastly, the sixth integration is the head, neck, and jaw integration. If you have any questions, you let me know. I'll follow up with some anatomical trainings or representations of what we went over so everything pulls together for you. I hope you're good. Let me know if you have any questions again, and I'll see you guys soon.